is Jessica Knebel doing another test mode for an educational video about the new VAC Cleanse Choice wound vac options. This is for my capstone project, end of the year project. And wound vac therapy, as we already know, is utilized in wound healing. It is used on usually open wounds. You can sometimes visualize structures underneath the muscles. For example, you can see tendons, sometimes you'll see bone in those stage 4. You can sometimes also see other underlying structures. You could see organs if they're on the front of a patient. And so this particular dressing is very appropriate for one that would have a lot of undermining, tunneling, if you have slough and eschar, and that's what's really great about this new product. Wound vac therapy is utilized intermittent or continuous, as you can see. Those are two different settings you can have. You can also use wound vacs over incisions now. For example, if you have a patient that's had a flap, this is an example of a sacral ulcer. Many of those we can prepare for surgery with the wound vac, but then you'll have to actually go in and do a flap, do a graft, depending on what type of procedure the surgeon chooses to do, what's appropriate for the patient. But we can place vacs on incisions now. That's something we're seeing more often. We just use supplies such as Wound Veil or Restore or other products that would usually cover any sutures or staples. So we can use them on incisions. The way that the wound vac assists with healing is that that negative pressure will remove exudate. These new dressings can now remove slough and eschar to prepare the wound bed for the next stage, whether it be delayed secondary intention or closure by surgery. So it will remove the exudate in the wound. It will create a nice, clean, moist wound bed. It reduces inflammation by removing all of that extra biofilm that's in there, and it also encourages the wound edges to approximate. It encourages that healing from the inside out, and that's what's really great about wound vac therapy and all the different changes that they've made, whether it's just straight vac therapy, or if it's now vac therapy with installation, or this new dressing, which is the VAC Cleanse Choice. What it looks like is it has these waffle punches out, and then you'll have a thin layer, and then you'll have a thicker layer. How this works is that this waffle or this punch out layer goes directly onto the wound bed, and then you can use these thinner and thicker pieces to do for tunneling and undermining. So what's really important with this type of dressing, you may have multiple pieces of sponge. It's very important at the end of your dressing change to mark how many pieces are in there, so that when they remove it the next dressing change, they know that they're removing all the pieces. So we talked about the benefits of wound vac therapy, that you can place them over incisions now, the intermittent or continuous, where it may have continuous pressure, but especially with VARIFLOW or the Cleanse Choice, you may be instilling a certain amount of solution for a set period of time. It's going to set. It's going to sit there and loosen up the debris. You can loosen the eschar, essentially all of those, the biofilm and elements that are in the wound bed. It loosens that as it sits, and then as the intermittent therapy is then turned back on, it will remove all of that, which is what is cleaning the wound bed. And this new VARIFLOW Cleanse Choice has been shown to clean wounds faster, often allow for reduced number of debridement if necessary for closure. So it's been a great dressing that was just released this year in April. The types of sponge that you can have with your dressings, you're probably familiar with the black sponge, and other options on the market include an antimicrobial silver sponge. This one is not used quite as much anymore now that we have more options for installation. We don't necessarily need the silver properties of the sponge, but it is there and it is utilized in some cases. And then there's a concern when you have underlying structures in your wound bed. For example, if you have tendons, if you have sutures from maybe an abdominal surgery, or you could see bone, and that's when you see the white foam, and that's what's utilized to protect. It does reduce the amount of suction, and so you want to make sure you only place it where you need to, but you do want to refer to the physician's order. And so that's the third type. So now I'll be showing you the application and exactly where these products go. Alright, so we've already prepared the wound bed by cleansing, drying, and then to save time, I have placed the drape around the wound. It's important, very important to make sure this step is not skipped because you need to protect that peri-wound skin. After I place the drape, just to help, you can use skin prep that comes in the package, or on the floors we have the lollipops that you're probably familiar with. And so I usually skin prep all of the area around to make sure, especially that helps with getting a really good seal. Okay, I'm letting that dry, and then we talked about the different types of the foam. I have my contact layer, and then I have my thick and my thin foam. So this thicker layer here, I have a section of undermining that I've shown you, and so I'll be sticking that under here. I have a small section to go into some tunneling that you can, I don't know how well you can see, but there's tunneling that goes back a little ways, and so I will use a thin strip in here to place. Obviously poor Seymour Butts, I would be making sure that he's comfortable, but he's my volunteer for the day. And my contact layer. This is the layer that goes onto the skin, and this is what promotes that removal of the exudate, your fibrin, your all the different biofilm that could be on the wound bed inhibiting healing. And so that goes on first, and then you will have a section that goes on top. It doesn't matter if it's the thick or thin one, but it just, as long as you have a good covering before turning on the wound vac. We'll go ahead, and I've already pre-cut this to go over, because you're going to go ahead and cover up. Okay, you have your second layer that will come off. Okay. In the meantime, I'll go ahead and turn on my machine. It's already prepped with my normal saline. You may have an antimicrobial solution depending on what the physician orders, but in this case, most often we'll just use some normal saline. I'm trying not to cut too many pieces. You always want to make sure that you have a good area for your track pad. Now, I understand on a sacral wound, you're never going to put a track pad right here. What you would always do is you would bridge up. Our patient has wounds on both trochanters, but you would always bridge up a section of the foam, and again, protect the skin by putting a thin layer of the drape. So you have a thick section of drape. You'd have your track, the sponge that's tracking up, and so you'd place your track pad more on a hip, or at least on a part that's fleshy, so you would never have this actually on, but for educational purposes, we're just going to put it right here to show how the equipment works. And it's important to also note that I didn't stuff the sponge over and extend past the wound edge. You want it slightly inward, because that is going to that's going to be what's going to encourage the healing inward. It's going to encourage the tissue to heal and to approximate. So just for the purposes of the video, we'll go ahead and place the track pad. You may still need to use some skin prep on the outside to encourage a good seal, but once you have everything in place, you can go ahead and now this is a demonstration with saline that may not be instilling, but what you'll see is you'll see the suction turn on. Let's check our therapy settings. We'll just do regular VAC therapy, 125, low continuous. And so ideally, you'll check your connections, you'll make sure that nothing is clamped. And you'll see how it pulls in. It has a raisin type look, and then you'll also note you can do a seal check, and you always want to have it below that line there. When it starts to get questionable, you can see yellow, and then when there's a leak either at the dressing or maybe there's a clamp, or if the machine is full, it'll start to alarm, so it can tell you what to do. So this is the new VAC VeriFlow Quick Choice Cleanse that we have. It's biggest differences are the different types of sponge that you'll put, and also the fact that it just is a much more efficient product, and so we might be using these on the floor more frequently in the future. Thank you so much.